Well, it's well known that people of color receive poorer quality health care than their white counterparts. White people who have the same conditions, same socioeconomic status, same insurance level, and so on, that people of color are more likely to receive poor care. On top of that, you have the stress from a lifetime of exposure to racism, kind of this chronic stress that results in increased blood pressure, a weakened immune system. If you're pregnant, there's a decreased blood flow to the placenta, increase in stress hormones like cortisol. And so all of those things can be measured, and this is well known that this happens. And those are the things that contribute to things like kidney disease, diabetes, low birth weight, prematurity, infant mortality. So that's one of the factors that accounts for the disparities in health outcomes and health status for people of color compared to whites. Well, one factor is that people of color are much more likely to receive poorer quality of health care from healthcare providers than their white counterparts are. If you have, let's say, a black man with diabetes and a white man with the same stage diabetes, same insurance status, same socioeconomic situation, the black man is much more likely to have his foot or leg amputated than the white man is. The same thing holds true for cardiovascular disease, for children with asthma. Whites are historically much more likely to receive better care than people of color are. And there's a study out that covers 10 years worth of research that documents that very clearly, that there is very definite discrimination in the quality of care given to people of color compared to whites.
Okay.
Well, stress plays a very important role in health outcomes. Now, we all know that everybody faces some kind of stress. There are many people who live in poverty, who are unemployed, who have been evicted, all sorts of stressors in people's lives. But for people of color, there's an added stressor, and it's not a one-time thing. It's an exposure to a stressor over an entire lifetime, and that's the stress of racism, of being followed in the store, of being stopped because you're black while you're driving, of being called names on the playground. All of those things over a lifetime results in this chronic stress. And that chronic stress, in turn, has physical changes in the body that we can measure. Things like high blood pressure, lowered immune system, so you're more likely to become ill if you're exposed to infectious disease. There's a release of stress hormones that kind of bathe the body in this stress. So all of those things can result in health inequities such as kidney disease and diabetes and infant mortality, low birth weight, premature birth, things that we see disproportionately among people of color. And it's believed that it's that chronic lifetime stress that causes those conditions to be more common among people of color than among whites. Well, the clients that we serve in our program, we work with the Strong Beginnings program, working with pregnant women during pregnancy and then for 2 years after delivery. And close to 95% of our clients are African American or biracial, and most of them live at or below the federal poverty line. And what they have shared with us, what they experience is difficulty in accessing resources, difficulty in getting to health care, being treated with dignity and respect, not across the board, of course, but this is reported that they also have competing demands on their time. They have welfare to work requirements to meet. They might have 2 jobs in order to support their family. They deal with childcare issues, with lack of transportation. So there are multiple barriers to their accessing health care as well. We also know that aside from race, that their health insurance status can be a barrier to receiving quality or respectful care. We did some focus groups here with women and their experience of pregnancy. This was African American women in Kent County. And they reported feeling as much discrimination based on their insurance status, if they're on Medicaid or had private insurance, as they did based on their race. So to me, this shows that they're dealing not just with issues of race, but also of class. So they have like a double whammy. It's racism and classism. So what we found in community conversations and focus groups with African American women here in Kent County is that they felt an equal degree of discrimination when they had Medicaid compared to when they had private insurance, as they did based on their race. So what this means is they felt doubly discriminated against if they had Medicaid and they were African American or woman of color. So they're feeling discrimination based both on their race and on their income level, on their insurance status. So the clients that we serve face multiple obstacles to being able to obtain good health care. First of all, many of them don't have any insurance until, say, they become pregnant. So they have no access to preconception health care or to health prevention, health promotion services. So they're coming in already with maybe a lot of unhealthy behaviors or risk factors. But then even when they do try, which most of them do, they want to be healthy, they want to have healthy pregnancies, but they face so many barriers, societal, structural kinds of obstacles that are in their way. And these could be things like lack of transportation, clinic hours that don't meet their needs. They might have to work 2 jobs in order to make ends meet or put food on the table. They have children to take care of without access to quality child care. Not having the right kind, or they have to run around trying to find a healthcare provider that will accept their kind of insurance or Medicaid. Not being able to go outdoors because they live in unsafe neighborhoods, so they can't be outdoors getting exercise. They don't have access to fresh foods and vegetables. So these are larger systemic issues that impact their health status. You know, historically, when this country was founded, settled by the white immigrants mainly from Europe, systems and structures were created with the intent of trying to protect white privilege. So policies and practices were built into those systems and structures. And those have continued to this day. And so nowadays, maybe not intentionally, but an unintended consequence of how these systems were created continues to have negative effects and to perpetuate discrimination. Again, it may be completely unintentional, but it is there and it is being felt. We see this in things in the justice system, in the educational system, in the healthcare system, the banking system. Just even nowadays, we know that a black man and a white man, same status, same history, committing the same crime, the black man is 48 times more likely to be imprisoned for that crime than the white man is. So we continue to see these kind of disparities in all of our systems. And until we address those root structural causes, I don't think we're going to be able to achieve racial equity in healthcare or in any other arena. I think first of all, we need to just raise awareness about the existence and consequences of racism and its effect on health disparities. You wouldn't believe how many people I talk to that say, racism? We took care of that in the 60s. We're not a racist society. I'm not a racist. And so just raising awareness about its prevalence to this day and how maybe it's not seen as much because it's gone a little bit underground, it's more subterranean, it's not so much in your face as it used to be, but it is there and we need to acknowledge that. We also need to acknowledge that there is white privilege and that those of us who are white do stand to gain from this privilege. And we have to be intentional about acknowledging that privilege and intentional about dismantling structural racism. I think we also need to strive much more intentionally to achieve a measure of parity in income, in wealth, in education and justice, that we have a living wage, not just a minimum wage, that there's equal access to appropriate quality health care. We need a much more investment in health promotion and health prevention, particularly among communities of color. And I think finally, and this might be the key piece to me, is that we as a community need to start valuing social responsibility at least as much as we value personal responsibility. As a community, we really need to start valuing social responsibility at least as much as we value personal responsibility. It would mean that we would have policies in place, that we would have budgets that promote social well-being, that we don't blame people for being poor, blame them for having poor health, that say people who are smoking, maybe, with nicotine addiction, and they're suffering from depression and mental health issues, that they're able to get the help that they need, and that this is seen as a lack of access to care and a response to depression rather than just a choice, a behavioral choice. That say maybe women who are overweight, who don't have access to gyms and to healthy foods. They can't afford those healthy foods. What they can afford is a double cheeseburger down the corner. But they can't afford the broccoli and the blueberries that would help them be healthy. They can't be outdoors exercising or walking because they're in unsafe neighborhoods. So those kinds of things, creating more green space, improving transportation systems, living wage again. Those kinds of activities that I think will have a greater impact than trying to change individual behavior one by one.